in general, there is a perception that migrants are not very healthy. This is not the case. In general, migrants do have a good health. However, if you look at HIV and if you look at the new HIV cases in Europe, you will find that 1/3 is from migrants. And of course, then it's clear that the migrants are disproportionately affected by HIV. The question is, where did they get infected with HIV? And from recent investigations, it's clear that if you look at the migrants who are in the UK, that more than 50% of the migrants in the UK became infected in the UK. And if this is the case, it's very important that we pay more attention to prevention, and especially tailored prevention for the migrant group. Of course, it's very important to have an early diagnosis of HIV. Now, if we look at the figures, it's clear that more than 50% of the migrants are diagnosed too late with HIV. This is more than compared to the other high-risk groups, like men who have sex with men. And if you are diagnosed too late with HIV, you don't get the proper treatment, and without proper treatment, you can infect other people. So it is extremely important that also among migrants there is early detection of HIV. What is another fact, that is that for the undocumented migrants, half of the European member states don't provide treatment. So if you're undocumented, you don't get treatment. And I think this is really unacceptable, because if you do have HIV, of course, you need to have treatment. And again, this is for your own sake very important, but also for lowering the risk for the spread of the disease. So I hope that the public health people in Europe do realize that it is so important to advocate early diagnosis and access to health. And I hope that you could make this possible. Thank you.